Welcome back to Studio 5. It shows up in the form of red blotches on your face or frequent flushing. And according to Dr. Steve Jepson, rosacea is a common condition that can be easily treated. You hear from patients quite often on the redness in the face they want to diminish.
Right, and it's not only redness, it's flushing, it's a lot of broken capillaries. And some people with rosacea can also develop acne-like bumps in the center of their face that they often confuse with acne.
I was going to say, how do you know if it's acne or rosacea?
You look at it in the context of the redness and the flushing, and we talked about adult acne before here too. That can be hormonal, but this is a very different condition. It has a lot to do with a different kind of inflammation in the face and capillaries that are open and just blood kind of rushes into the face.
Is there a certain patient you see this most commonly on, a certain age bracket or lifestyle?
You know, it's a lot of people with really fair skin are a little bit more prone to rosacea. There's a lot of genetics involved, Northern European ancestry. We tend to see a lot more of it. I don't think environmentally there's definitely a environmental cause, but there's definitely environmental triggers. Heat, exercise, spicy food. Those things can really cause those blood vessels to dilate and will kind of exacerbate that flushing and that redness.
So what are the options for treatment? How do you get rid of the red?
Well, and it can be hard to get rid of it. And I think a lot of people go to their doctors and say, well, I have this, and a lot of times they're given prescriptions, and prescriptions are kind of hit and miss. Sometimes it helps, sometimes it doesn't. Usually they're given a prescription for either an oral antibiotic or a topical antibiotic, but it's not because that it's an infection that's causing it. The antibiotics that are chosen have an anti-inflammatory effect and kind of calm down some of that inflammation, and so sometimes works, though usually not all the way.
So you're really trying with those medications to tap into just one benefit of an overall prescription. Okay.
And then people with rosacea have very sensitive skin, and for those of you out there that have it, you know that you have to be very careful about what you put on your skin. And so we're always guiding people in terms of what kind of cleansers and what kind of moisturizers can you use. And my rule of thumb with rosacea is always less is more. If you look at your bottle of moisturizer and there's 40 ingredients there, then there's 40 chances that one of those is going to irritate your skin. So I always tell people, choose something with very few ingredients. There's several ingredients like alcohol or certain fragrances or sodium lauryl sulfate that are very common triggers for that redness, and so you want to be very careful about what you put on your skin. We can help guide people with that. And then sunscreen is very important too, because the sun will cause those arteries to dilate and will make that redness even worse. And so I always tell people 30 SPF all day long, reapply several times a day.
Are there any procedures that will really help treat that?
Well, that's what we do, and so there are procedures for sure. And you know, I've been doing lasers on rosacea for about 6 years now, but over this period of time, as with everything, the technology gets better and better. We just got a new laser in that I'm very happy with. It's an intense pulse light laser that has great technology, great protocols in terms of treating rosacea. Laser works for rosacea by closing down those capillaries that are causing all that redness. It will also kind of help calm down that inflammation, and it will also, we can also use the laser to kind of erase those tiny broken capillaries. So I find that for most people, laser is the most definitive way to kind of help get rid of rosacea.
Is it permanent?
You know, it helps, and it reduces the chances that you need to do the lasers over and over again down the road. Sometimes you have to do a maintenance treatment here or there. We're really good at helping people in terms of guiding them after they've done a laser procedure in terms of what skincare they should be using and what kind of types of medications that they can use and what kinds of triggers they can avoid to keep those arteries from dilating again. And in that situation, a lot of times we can prevent laser treatments down the road.
So it's the overall treatment. You offer a free consultation for people.
We do offer free consultations. We'd love to have you come in and we tell you about this new great system that we have.
It sounds great. Steve, thank you so much. Steve, of course, located in Murray. Phone number and website listed on the screen. You'll find that same information on our website for you, studio5.ksl.com. When we come back, how to stay ahead